Hello guys, Dr. Molly Hart here with Pelvic Balance Physical Therapy. So right now I'm hooked up to my handy dandy Biofeedback machine, and this is what I use when I am helping women to have awareness of their pelvic floor and to train them either in a strength training program or even to down train them or relax their pelvic floor muscles because they're too stressed out. When they're too stressed out and the muscles are really tense, it can cause pain in the vagina and in the rectum for both men and women. As far as the rectum goes, men don't have vaginas, hopefully. But in all seriousness, if you're having pain, we need to down train and relax the muscles. If you're having really bad constipation and you're not doing a great job at releasing the bowel and you feel like you're straining too hard, this is something that could benefit you. So anyways, right now, if you want to, I've got this cool little wire hooked up to me, which is hooked up to this wire, which is hooked up to electrodes that are on my butt. Yep, that's right, they're on my butt. They're not internal, but they are on my butt. So if you come to see me, that's what you're expecting. This all connects to this machine right here. Now this is my readings right now on my pelvic floor. So I've got 3 electrodes, one that's a ground lead that's on the bone called the sacrum, and the other 2 are right around the rectum. Like I said, they're not inside of it. So right now, while I'm standing here, you can see a little bit of activity in my pelvic floor muscles. The microvolt reading is the recruitment. So this is not showing exactly the strength of my muscle, but it's showing the ability of the nervous system to recruit that muscle. So if I do a Kegel or a pelvic floor contraction, you can see it lift up. Let me change my settings here real quick so it makes it look a little bit more dramatic. So if I do a Kegel, you can see it lifts and goes back down. If I walk around, here, my cameraman is my husband. He's doing a great job. When I laugh, you can see I get a nice rising. That should happen, otherwise I would leak. If I cough, you can see I get a nice little rise in the readings. If I stop talking and I let it relax. Okay, now if I want to do a sustained hold, which is something that I'll go over with women, you can see I can now squeeze and I'm going to hold that muscle contraction. I'm holding it, I'm still talking, which means I'm still breathing, so I'm not holding my breath. If you want to pan around to me now. So as I'm holding this, I'm sitting here squeezing. My body's nice and relaxed. I'm not sitting here squeezing my legs, I'm not squeezing my butt cheeks together. I just have a simple, so I'm going to relax now. And I'm going to re-squeeze. You can not really tell much of what I'm doing. You might see my stomach come in a little bit, but that's about it as I'm holding this. All right, now let's pan back around to the screen. Let's go over what down training would be. So I'm going to stay relaxed. And you probably can't see my numbers, but right now I'm resting around 3 microvolts. Okay. So what I'm going to do now is I'm going to bear down, meaning I'm going to push my pelvic floor muscles downwards, lengthening them as if I was going to pass gas or if I was going to have a bowel movement. And you're going to see that this reading is actually going to go downwards when I do that. So it's going to go up at first, and now I'm going to sustain it down. And I'm releasing. Sustaining it down. And release. So this is me working a little bit harder at it. You can see I'm getting it down even lower, and I'm going to release. I'm going to let it go back to baseline. So this is me doing nothing right now. I'm going to bear down again. I'm going to release. I'm at baseline. I'm going to Kegel. I'm going to go to baseline. I'm going to bear down. You see it goes downwards. I'm going to hold that. Let me release. Let me do a Kegel. Relax. Go ahead and pan to me now. So point is, what I'm trying to show with this is when you have really, really good awareness of your pelvic floor muscles, you are able to do what I just kind of did there. It's almost like you're painting a picture with your pelvic floor. And this is funny. I mean, I'm not gonna lie, I've got electrodes connected to my butt. This is funny. But in all reality, women, when you have good awareness of these muscles, it is extremely important. Why is it important? I could go over a ton of research, and there's so much research to support this. I cannot even begin to tell you. But when we have a strong pelvic floor, we are really doing wonders as far as keeping everything nice and tacked up. We have a lot of organs, the cervix, the uterus, the bladder, all of our intestines. Our vagina and our rectum are relying on this muscular strength, this muscular hammock to support our tissues there. If we've had children and we've had multiple children, we are now stretching out these tissues, and we are, every time you have a delivery, think about it as an acute injury. You are having an acute injury to your tissues, right? We get tearing, we get all these things. It's natural and it's part of life, but it doesn't mean we shouldn't rehab it. People get a little baby dinky knee surgery or like a little scope, and they go to PT for 8 weeks. Women birth an entire baby and we get nothing. I mean, it's a little bit ridiculous, and I could go off on a rant for it, but we need to be strengthening them. Also, if we strengthen them and we can keep everything protected, we're not gonna have to worry about urinary leakage, which is a super common problem when women have children. Even when they don't have children, women who do a lot of weightlifting and who are lifting improperly, they also are going to have a lot of leakage issues. Now, what happens if we start to get prolapse further down the road? This is more common the more vaginal deliveries that you've had. What often is going to happen is either nothing's going to be done by the gynecologist or urologist, or often they will recommend you get a bladder sling surgery. A really good, up-to-date on research gynecologist will refer you to a pelvic health PT, which is awesome. And I love those types of healthcare providers that are aware of the conservative treatments for this. So point being, we can help protect our pelvic organs. Also, another wonderful bonus is it does improve your sex life. If I have better awareness of these tissues and I can feel more down here, imagine I can feel more pleasure now when I'm having sex. So the body, the brain, we have a part of the brain that is called the homunculus. It's like a little body map. And the more awareness we have of our body regions, the more that our brain is able to understand messages that are being sent up, and the better it's able to send messages back down. So a lot of the times, women who have significant pain, they have very poor control of their pelvic floor muscle. Normally the muscle is very hypertonic. Their resting tone is not going to be at 3 or 5. It's probably going to be much higher, like around a 10. If I ask them to bear down, they cannot do it. In fact, when they try to bear down, it goes up in the readings. So when you hook up somebody that has a healthy pelvic floor, you can see how easy it is to do these, to essentially control what the muscles are doing. Now, using this equipment, I will tell you it's much easier for me to train individuals, because if I don't have this equipment, it's extremely difficult to put you guys in functional positions to do your exercises. One last thing I want to go over for those that are high level and you're like, I don't need this. You still probably do. Let's go over a squat real quick. So if I'm going to stand here, I'm going to go down into my squat, and as I come up, I'm squeezing my pelvic floor. Oftentimes people don't do that. Let me change my readings on here. So I'm going to go down and I'm going to come up. And you see, as I come up, I get that nice powerful lift. Go down. So women who leak themselves, this is what I'll see on the readings. They'll go down, and then when they come up, I don't even know if I can do it. When they come up, they actually get a downward pivot here instead of an upward contraction, which is why they're leaking or having prolapse like symptoms when they're doing their squats, when they're doing their lunges, when they're doing their deadlifts. So just because you think you're doing something right, by the way, I've had women who think they're doing it right, and I have them hooked up to this, and they are not engaging their pelvic floor muscle properly. So just wanted to show what this beautiful machine is that us pelvic health PTs will utilize when we're training you guys, because it's nice to have a visual representation of how we will use this with you guys. So have a wonderful, beautiful rest of your night. Thank you for listening. Kegel on.